Good afternoon and welcome. I'm Senator Bill Frist. This is part 4 of our continuing COVID discussion series on the fiscal, monetary, and health policy responses and implications for the economic outlook. Our discussion is sponsored by Princeton University's Griswold Center for Economic Policy Studies, the Center for Health and Well-Being, and the podcast, A Second Opinion, Rethinking American Health. I'm excited to be here today with Princeton University's Jessica Metcalf, Alan Blinder, and Bill Dudley. Our discussion will look at our current understanding of the fiscal, the monetary, and the health policy implications of the pandemic, continuing to build on the themes we discussed in our previous webinars in April, in June, and November of 2020. If you missed those earlier discussions, you can find them at asecondopinionpodcast.com or on the Griswold Center website. A little more about today's presenters. Jessica Metcalf, Assistant Professor of Ecology, Evolutionary Biology, and Public Affairs at Princeton. Professor Metcalf is a disease modeling expert. She will kick off today's discussion offering the latest understanding of the epidemiological trajectory for the disease and its health policy implications. Alan Blinder, the Gordon Rechler Memorial Professor of Economics and Public Affairs, former Vice Chairman of the Board of Governors of the Federal Reserve and Economic Advisor to President Clinton, and he will share his insights on the fiscal outlook. And Bill Dudley, Senior Research Scholar at the Griswold Center for Economic Policy Studies and former President of the Federal Reserve Bank of New York. Bill will share his perspectives on the monetary policy implications of COVID-19. Each of our presenters will open with approximately 10 minutes of comments, and we will then turn to a general panel discussion followed by your questions. You're welcome to submit questions at any time by clicking on the Zoom Q&A feature located at the bottom of the Zoom window. You can also upvote any questions you would like to see answered. We will get to as many of your questions that time will allow. I should also add that a full recording of the talk will be posted on the Griswold Center's website and next week on A Second Opinion podcast on Apple Podcast or Spotify or YouTube or wherever you listen to your podcast. Before we dive in, I just want to reflect really quickly for a moment on the last year and a half. The four of us first got together a year ago this April for our very first virtual event on COVID and the economy. And I know none of us predicted at that time all of the challenges our nation would face in the year that followed. Our healthcare systems were stretched to the max. We saw record unemployment. Racial justice and social equity movements swept the country. And we continued to have a stock market that seemed almost out of touch with what we were experiencing on Main Street, USA. We're enjoying the beginning of a spring now, and with that, the start and reopening that has been made possible by nothing short of a modern medical miracle. But we're also confronting increased national skepticism of science, of government, of institutions, and a trend of vaccine hesitancy that is handicapping our best chance to beat this virus. With this backdrop, today's presenters will shed light on what the latest economic indicators mean and what we can learn from the events of the past year and how the pandemic will influence policy going forward. And now let me turn to Professor Jessica Metcalf. Jess?
Thank you. Just sharing my screen. So thanks for that introduction. When we first spoke, the pandemic was just taking grip in the United States. There have been many successive waves of cases since then, at different times and in different places. For the first months of the pandemic, the only controls we had over the numbers of cases was really physical distancing. Physical distancing continues to be an important tool, but other factors are beginning to shape the ebbs and flows in numbers of cases. At least in some populations, the fraction of individuals who've been infected may have reached sufficiently high levels as to reduce the spread of the infections and slow the numbers of cases, starting in late 2020. In December 2021, the first worrying news came in about novel variants that had different properties from what had been experienced over 2020, specifically faster spread. This proceeded to alter the increasing number of cases around the world wherever this variant reached. In 2020, the welcome and exciting news of efficacious vaccines broke, and these were authorized for emergency use in the US, first Pfizer and Moderna in December, and Johnson & Johnson in February. The new things that will shape our future are these novel variants and our vaccines, so I'll touch on both quickly. So first, a quick reminder about how this virus works. The virus binds a thing called an ACE2 receptor on cells in the upper respiratory tract. It then starts to replicate, and then worse outcomes are associated with replication lower in the lungs. This virus will be cleared by your immune system, but of course, one of the challenges is that immunity also drives many of the symptoms. By analogy with friendly fire in some sense. Mutations happen all the time, and you can think of them as being like spelling mistakes from the point of view of the virus. Many of them may not change the meaning in some sense of the viral genes, but if they do, they mostly make things worse for the virus, not for us. Mutations that change the functioning, or what we call the phenotype of the virus, in ways that increase spread are the ones that concern us. They're likely to be rare, but they're beginning to emerge. So far, these new functionings, which we refer to as phenotypes that have been described, include increased avidity for that receptor on our cells, so increased stickiness to the cell receptor, increased transmissibility, so faster rates of travel from one person to another, increased capacity to overcome natural or vaccinal immunity, which is particularly worrying, and increased virulence, so this is capacity to create hospitalization or severe outcomes. The variant that was first identified in the United Kingdom, B1.17, has been identified as having that increased avidity, which you can see might lead to increased transmissibility, just because it makes the virus more sticky, so it sticks to us more quickly, as well as increased virulence. And the virus that has been first detected in South Africa, B1.351, has also been shown to escape immunity to at least some degree. The virus first identified in Brazil, the variant of the virus first identified in Brazil, P1, has shown both increased transmissibility, increased capacity to overcome natural vaccinal immunity, and increased virulence. These are not all entirely pinned down, but there are suggestions in these directions. A natural question is, why are we seeing the sudden surge in variants at the end of 2020? It might be partly because we're looking, but the world has changed phenomenally from the point of view of the virus because so many more people are immune. So this means that the strategy that was working well for the virus early in 2020 is not going to be working as well towards the end of 2020 and 2021, which creates this selection for the virus to develop new tricks. Moving to the vaccines, what do we know about the vaccines? The first thing we know is that we're extraordinarily blessed by the talents and hard work of the scientific community and all the volunteers and all the trials that have made these possible. It's extraordinary that we have so many. Having so many allows us to be flexible in our response. Those authorized in the USA include Pfizer, BioNTech, Moderna, and Johnson & Johnson. The first two are mRNA vaccines, which have high requirements in terms of cold chain and require 2 doses. Johnson & Johnson, just a single dose and less hungry in terms of cold chain, which is important from the point of view of logistics and delivery, particularly in low-income settings globally. Most trials for the vaccines initially had symptoms as the focal endpoint, not severe disease or prospects for transmission, but there is accumulating evidence that they do also reduce transmission. So it means it doesn't just stop me from getting symptoms, but it actually stops me from carrying the disease or at least giving the disease to other people if I were vaccinated. There are critical questions remaining. What is the duration of protection? We still don't know because we can't know. It takes time to know. Can these vaccines be boosted? Will they respond to mixing and matching of the different vaccine platforms? And how will they fare in the face of these novel variants? This is a really important question, obviously. The trials were not designed to test the optimal boosting strategy, but this is another important question and a logistical question going forwards. And of course, and Senator Frist referred to this, there is a question about willingness to be vaccinated and how this will change over the coming years. One that's perhaps slightly more elusive to immediate access is the fact that we need to start thinking about in vitro surrogates of vaccine efficacy and protection. And this is because it's no longer going to be so easy to do trials because you won't have a control group anymore. Most people will have been vaccinated or might have been infected. There is starting to be good evidence around this. So for example, on the x-axis here is a measure of serology, which is a measure of the immunity in your blood in some sense, plotted against vaccine efficacy, which means you could go out and measure people instead of doing these enormous trials to get at least a sense of how effective these vaccines might be. Of course, it's not just the United States we have to think about when we think about this pandemic, because nobody's getting out of this until we're all out of it. The director of Africa CDC had an article in Nature pointing out that Africa will need 1.5 billion doses of vaccine, which isn't a huge amount of funding, but it is still inaccessible in many of these settings. There are organizations set up to try and grapple with this issue, in particular COVAX, which has guaranteed sufficient vaccines to reach 20% of the population by the end of 2021 for each of its signatories, and is likely to be extraordinarily important in this global question around reach, equity, and vaccines. Of course, the African Union has also been active, and the African Vaccine Acquisition Task Team has secured 1 million additional doses and is aiming for 60% of the population. And similar efforts are going on in different areas all around the world, including the lower income areas. It's a fast moving set of considerations. Last week, Johnson & Johnson pledged 400 million doses to the African Union. So the question then becomes, it's wonderful we have vaccines. They are reducing the burden and potentially reducing transmission, or it seems reducing transmission in many settings. We must worry about whether these vaccines will continue to be efficacious in the face of selection on the viruses. The vaccination that there is a question, and this is an unanswered question, but vaccination that results in intermediate immunity might favor selection for immune escape variants. And the logic behind this is that if you don't have any immunity at all, there's no selection on the virus to escape because there's nothing to escape. If you have complete immunity, so you can clear out every last virus particle, then again, there can be no escape because there's no viruses to escape. But somewhere between those two extremes, you might have a setting in which viruses are under strong selection to escape immunity, which would lead to a problematic future. The trouble is we just don't know what this landscape looks like. We'll learn more as time goes on. There does seem to be reasonable amounts of cross-protection among the variants. So immunity developed to escape variants seems likely to protect against other strains. This is really good news that came out of South Africa. But one of the important things to think about is that this immunity is still likely to wane, and those characteristics of secondary infections or infection after vaccination are poorly known, but are likely, just because of the reach of our vaccination coverage, to govern our future for years to come. And it may be hard to know what's going on. This map just shows a guess of what the burden would have been had we assumed 40% of the population was infected in sub-Saharan Africa. But the fact is, reporting of cases and even of deaths is likely to be extremely low in these settings. So we'll have a very incomplete picture of the pandemic, of where cases are and where selection for novel variants might be occurring in many parts of the world. And in these parts of the world, the numbers of cases does seem to be increasing. This is just a few exemplar countries from sub-Saharan Africa. So I think what will determine from the epidemiological side the future is hesitancy, equity in vaccination, waning of immunity, and evolution. The big questions in terms of hesitancy is how can we mitigate hesitancy, and how do we manage inevitable vaccine event responses to best maintain population immunity while also adequately being transparent. Equity is clearly the morally correct approach to vaccination, but it's also pragmatic, since allowing circulation anywhere is allowing selection for variants anywhere. So there is a big question about how to manage global access to vaccine doses. We still need to know how long immunity lasts. We won't know this for a while. It just will take time. It'll take convenience and longitudinal studies. We also need to know the nature of secondary infections. If it is the case that once you've been infected, you can get infected again, but you don't show symptoms, then we're in a very different world from if you get infected again, you do show very serious symptoms. And similarly for vaccination. If once you've been vaccinated, the secondary infection you get is very mild, then suddenly the landscape of the future looks very different. And the question of the evolution of variants is, of course, extremely pressing. And I think it's incredibly important that we both sequence all breakthrough cases and emergent viruses that we can to try and keep track of what's going on. And these are some of the references from some of this work, and that is what I have.
Jessica, thank you. And we'll come back to especially that last slide, I think, in our question and answer with that. Great job. Let's turn to Alan Blinder. Share with us some of your insights on that physical outlook.
Sure will. I'm going to share my screen. Let's see, slideshow. Okay. Good afternoon, everybody. As Senator Frist mentioned, this is the fourth. I call that update number 3. Which means the same thing, but the numerology probably should be more uniform. We last did this in November, 5 months ago. And at that point, this you've probably seen, this is the New York Times graph for the US of cases. This is when we did the last update, and both the level and the slope of this graph were frankly frightening, especially the slope. You see that got a bit better, but though the level went worse. So this is where we are today. People are feeling a lot more comfortable in America, probably too comfortable. I mean, if you compare this level to where we were at the beginning, it doesn't look very good at all. Compared to where we were at the worst, it looks wonderful. And that last remark, I think, is having a big effect on the economy. It's sort of, you know, the old cliche was, what have you done for me lately? This is what have you done to me lately? And a lot of people are probably insufficiently scared about COVID-19 now. For that and other reasons, and I'm going to talk about the other reasons, the economy is perking up strongly. I showed these two graphs 5 months ago with not as much data as we have now. The left-hand panel is jobs, employment, and you can certainly see the dramatic effect of when the pandemic struck. Employment fell 14.5% in 2 months, which was, I mean, earth-shattering. Made the Great Depression look like nothing. But that was 2 months. And ever since then, the payroll employment has been climbing back, and it's now 5.5% below where it was before the pandemic struck. Real GDP had a similar performance, fell like a stone in 2 quarters, mostly one, by 10%. This is not an annualized rate. This is the drop in the GDP, and has been climbing up ever since. Here, I've not just updated the data, but actually gone 1 quarter beyond what we know. This is a rough seat of the pants estimate of the first quarter of this year. That's quarter's over. We're in April now, but in terms of data, it's still young. We don't really know. I'm pretty sure I based this number on a 7.5% annualized growth rate for the first quarter. That's a guesstimate. So what we know is over these 4 quarters that are now history in terms of data, we got back about 3/4 of what we had lost in the horrific slide downward. So this looks like a V-shaped recovery, quite literally. You see why it's called a V-shaped recovery. Now, I want to point out something you probably noticed in the numbers. The declines in GDP over either the worst months or the year, 10% and 2.5%, were well below the corresponding declines in employment. What this says is that GDP per worker was low for the people that lost their jobs. And similarly, it's going to be lower than average for the people that gained their jobs. There's a lot of talk about the K-shaped recovery. That's the up that we're having now. Go back. This part, well, I'm talking about jobs. This part, but it's been very uneven, as has been remarked by many people. The upper income groups are doing much better than the lower income groups. Senator Frist alluded to this in his opening remarks, and I certainly hope America won't forget this when the pandemic is in the rearview mirror. It shined a very bright and not very happy light on inequality in America. That said, I put forecasted in quotes because, as I said, 2021 first quarter is actually behind us, but not in data. Popular forecasts are running in the 7 to 8% range, which is why I used 7.5 in that previous chart. I just want to remind everybody, the economists on the call don't need to be reminded, I don't think. We're going to get a first estimate of first quarter GDP at the end of this month, but those initial estimates are always based on partial data. GDP gets revised several times before it's finalized, simply because all the data are not in. Well, there are other reasons, but the main one is all the data are not in yet. So there is always a danger that the first estimate of the quarter is misleading. I don't know what it will be. I use 7.5% in that graph. Looking longer, just a few days ago, the Wall Street Journal published its periodic poll of economic forecasters. And for the entire year 2021, fourth quarter to fourth quarter, the average of these men and women was about 6.5% growth. That's a big year. And frankly, my guess is if you polled the same people over again today, they'd be higher on average because some good numbers have come in. So we're looking at a boom year in 2021, unless something terrible happens. As I noted here, the last year, if you go back through history and ask how far back do you have to go before you had a 12-month, 4-quarter period that beat 6.4% growth, the answer is the end of 1983. Senator Frist and others will remember that was morning in America, leading to the landslide re-election of Ronald Reagan, et cetera, et cetera. So that was a big macroeconomic event, and 2021 looks very good from that perspective. I add as a footnote, unless you're on the bottom rung of that K, in which it doesn't look as good. So what's behind this? Well, it's no mystery. I put in first place with 2 exclamation points the vaccines. We would not be in a position like this were it not for the vaccines. You remember that chart I showed you, we last talked in November. That was the pre-vaccine world, basically. We're now getting many, many, many millions of people in America and around the world vaccinated, which is fantastic. And as the senator said, and as Jessica said, a tribute to the scientists that did this for us. We owe them an enormous debt of gratitude. Second on the hit parade, I put the resilience of the US private sector. American businesses and consumers snapped back amazingly quickly, arguably too quickly with openings, but in any case, amazingly quickly. But that said, they got big assists from fiscal policy. I put this in bold because that's what I'm going to concentrate on the next couple of slides. And also from monetary policy, which Bill Dudley will talk about after. So this is the big 4 that led to this sharp V-shaped recovery that we're in right now. I'm leaving monetary policy to Bill Dudley, but I just want to say that I found it very surprising in a happy way that the Federal Reserve's interest rate cuts back a year ago, or more than a year ago, the Fed cut the interest rates to the bone right away as this pandemic crested into the United States. And I was skeptical that even at low interest rates, you could get Americans out into car dealerships, looking at cars, and going around with realtors looking at new houses. Well, I was right, but only for a quarter. So you see in the left-hand panel, sales of motor vehicles and parts plummeted, but only for 1 quarter, flatlined, and now have come up, and are amazingly, to me, if you'd asked me this a year ago, higher than they were before the pandemic hit. There's a similar pattern with residential construction, building of new houses. 1 quarter later, they tanked. Remember, this is construction, not just shopping. You actually have to be building the thing to get into this data. They tanked, and now they are soaring still today. And again, residential construction is way above the peak it had had prior to the pandemic. So I find both of these graphs amazing, actually. And monetary policy, cutting interest rates, has been a major factor. I didn't pick these two things at random. These are by far the two most interest-sensitive components of spending in the United States and other countries. This is US data. Okay, I said I want to talk about the fiscal expansion. So in a nutshell, this is it. The CARES Act, which I had talked about in one of these previous briefings and won't spend much time on today, was enacted at the end of March 2020, so a bit over a year ago. Its headline number was about $2.25 trillion, although I think there was some exaggeration in that number. And the summary, I talked about what was in the CARES Act in one of these earlier briefings, but the summary was, it was sloppily drafted. You could make a lot of complaints about it. The money was not well targeted. I'll come back to that in a second. But it had two very big virtues, which were hugely important in March of 2020, which was that it was huge and Congress did it quickly. Neither of those characterizes our Congress in normal times, making big steps and doing it quickly, but they did this time. So despite the problems with the CARES Act, I personally, and I think many people, give the Congress a big pat on the back for doing that. The next big dollop came at the very end of the Trump administration. It's called the Consolidated Appropriations Act. I had to look that up because I didn't know what they called it. This was a kitchen sink bill that included the appropriations for the next fiscal year and some other things. But a big part of it was more COVID relief, about $900 billion, a little under $900 billion in COVID relief. So that was the second big dollop of money, relief money. And the third, of course, came just last month with President Biden's American Rescue Plan, amounting to almost another $2 trillion. Add that up and you've got $5 trillion. That is a lot of money, even for a gigantic economy, a gigantic and rich economy like ours. And there's more to come. This is not the end. So the American Jobs Plan is now before the Congress, sort of, recently proposed by the administration and amounting to something above $2 trillion. There are many questions about that, of which the two big ones in this context are what's going to pass out of this list of many, many programs. It's not all infrastructure. What will actually get through the House and the Senate, and especially the Senate, and how much of that will be paid for? So the Biden administration's idea was to pay for this plan in the jargon we use in budgetary language, which just simply means either cutting some other spending or, in the case of the Biden plan, raising some revenue somewhere. And their main answer was from the corporation income tax. But how much in the end will actually get paid for versus how much will be a net fiscal stimulus, because it's spending that's not paid for. We're not even close to the beginning of having answers to those questions, and I don't want to hazard a guess, except to guess the fraction paid for will be less than 100%. I'm willing to stick my neck out that far. We'll see. Then there's another plan headed this way. It's getting called already the American Family Plan, though I don't think, well, first of all, the Biden administration hasn't released it yet, and so it doesn't have a name, nor do we know exactly what it's going to be in it, but there will be a lot. There was some chatter that it's coming very soon. Maybe it is. I don't have any inside information about that, but I do know that the congressional channels are a little bit clogged right now. The size is being guesstimated in the 2 to 3 trillion range. Now, we think in trillions these days. And the same questions will arise when that plan leaves the White House and goes to the Congress. What of it is going to pass and how much of it is going to be paid for? The Biden administration's initial answer, I think, will be the same all paid for. Now, we don't know what the pay-fors will be, and we certainly don't know how many of them will be accepted by the Congress. So this is a lot of money. If you're only just adding it up, which you shouldn't, because we don't know what this $2 trillion will turn into or how much this will be. But if you just add it up, you're looking at $10 trillion. This is a big sum. Now, I just want to remind everybody that these are 10-year numbers. America got into this bad habit many decades ago of citing things in 10-year dollops because that's the budget window. Economists would rather think of these as annual rates, meaning, for example, that a $2 trillion package is 200 billion a year. You know, they're not constant, but roughly 200 billion a year. And that's less than 1% of GDP. Now, I don't want to sneer at 1% of GDP. 1% of America's GDP is a lot of money, like about $220 billion these days. But on the other hand, it's only 1% of GDP, not 99%, not even 30%. So a $200 trillion package, if it makes sense on the merits, is certainly affordable. It's 1%, it's under 1% of GDP. I think that's a point that often gets lost in these gigantic numbers. A couple of other observations of the fiscal response, and then I will wrap up. Congress acted very quickly, I emphasized in March of 2020, but also in March of 2021 with the Biden plan. That got through Congress really, really fast. The fiscal response of the United States, if you compare it to other countries, is gigantic, much bigger than any other country, even as a share of GDP, I'm pretty sure, or by any standard you can think of. It's a big fiscal response. As I indicated earlier, some of the large components like the payroll protection program and these checks, first the $1,200 checks, then the $600 checks, then the $1,400 checks, were poorly targeted. In the case of the checks, many of the poorest and most needy Americans didn't get them. And some not at all needy Americans who hadn't lost any money to the pandemic did get them. So very poorly targeted. The fiscal response started strongly bipartisan a year plus ago, and now has become totally partisan. As you all know, the Biden plan passed the Congress with 0 Republican votes. And last but certainly not least, and this is going to lead into Bill Dudley and the Fed, all of this actual increase in the national debt and projected increases in the national debt that are coming has not driven up long-term interest rates. Now, some of you that watch the media are saying, has not driven up long-term interest rates? That's not what I hear. And what you hear is probably this. This is a graph of the 10-year Treasury rate, which I started in August of last year and continued to the last observation that was available. And people are talking a lot about this, and especially about this. This is what's happened to the 10-year Treasury rate since February. And that looks like a big increase. So what in the world is Blinder saying when he says it hasn't driven up long-term interest rates? This is what I'm saying. This graph covers the period from 2018, 2019, 2020, and into the early months of 2021. This hunk of it here is what I showed you on the previous graph. As you look at the rest, look backwards, you're reminded that when the pandemic hit, the 10-year Treasury plummeted down to below, to barely over 50 basis points. And when we look at what's happened since August, we say, oh, it went up from 50 basis points to 165 basis points. That's a big increase. Well, as an arithmetical statement, that's true, but it's very misleading economically. These rates down here were completely abnormal and aberrant. In the 2 years or so prior to the pandemic, we had 10-year rates in the 1.5% to 2% range. And if you go back a little bit further, they were up around 3%. So a 1.7% 10-year bond rate is by no means a high bond rate. The other thing you may be wondering about, and this will lead directly to Bill Dudley, is this because the Fed's been buying it all? And that's why you haven't had to place this in markets. The Fed buys it, and therefore interest rates don't have to go up very much. Well, that's half true. I looked it up in preparing this slide. Since the pandemic started, the Fed has bought on average 55% of the Treasury debt that has been issued. The other 45% has been placed into private portfolios, whether domestic or foreign. So this idea that the Fed has kept it down by buying is exactly half true, which leads me naturally to Bill Dudley telling you about what the Fed has done.
Good, Alan, thank you. And your slide there on the Treasury rates really demonstrates the importance of what I love about these sequential symposia that we're doing. That allows us to look at every 3 or 4 months through this, but also you can take us back to before, puts it in perspective. With that, let's do turn to Bill Dudley and let's talk a little bit about monetary policy.
Thank you, Senator. Let me pull up my slides. So I'm going to focus on monetary policy, and I think the story here is that the Fed took out all of the stops. They did everything they possibly could think of to support economic activity. They cut short-term rates to zero. They bought literally hundreds of billions of dollars of Treasury and agency mortgage-backed securities. They told the markets that they were going to keep rates low for a long time. First in March, they said that they'll maintain this target range until they're confident that the economy is on track to achieve its maximum employment and price stability goals. And then in September, they got more specific. They said, we're going to keep rates low until labor market conditions are consistent with maximum employment. Inflation has risen to 2% and is on track to moderately exceed it for some time. They also maintained their forward guidance on quantitative easing. In June 2020, they said, we're going to keep it for over coming months. Recently, Chair Powell has been asked at his press conferences, so when are you going to start to taper the asset purchases? And he has shut down that conversation completely. He's basically told people who've asked him that it's too soon to talk about tapering of the Fed's asset purchases. And finally, the Fed introduced a wide array of special liquidity facilities to support markets that went beyond what they did during the great financial crisis. Some of the facilities that were introduced backstopped the corporate and municipal bond markets in ways that the Fed did not do in 2008 during the great financial crisis. And as Alan noted, the Fed's efforts did help cushion the economic impact of the pandemic. The easy monetary policy provided quite a bit of support to the interest rate sensitive sectors of the economy, such as housing and motor vehicles. And the Fed's special liquidity facilities did restore market function. So corporate bond markets, for example, were under a tremendous amount of stress in March of 2020. But pretty quickly after the Fed introduced their corporate bond facilities, companies could raise large amounts of debt again in the market. You can see the situation of what the Fed's done today, where financial conditions are extraordinarily accommodative. So we're still in a pandemic, yet the US stock market is at an all-time high. That said, the benefits of what the Fed has done have accrued very unevenly, with higher income households disproportionately aided. Higher income households typically did not lose their job. They hold lots of financial assets. And so as the Fed eased financial conditions, there's been a bit of a windfall financially for higher income households. In contrast, for lower income workers, there's still a large employment shortfall. We're about 8.5 million jobs short of what we were going into the pandemic. Now, one thing that the Fed did as we were going through this entire situation was in the middle of the summer last year, they changed their monetary policy framework. And they basically said, we're going to do monetary policy in a different way going forward. We're now going to move to average inflation targeting. What that means is we're going to try to hit an average inflation rate of 2%. This is different than what they did in the past. In the past, they basically said, no matter how often we miss to the downside of 2% inflation, next year we're going to go back to 2%. In the current regime, they're going to try to make up shortfalls in inflation to the downside by inflation going above 2% And they're doing that to keep inflation expectations more firmly anchored around 2%. They were worried that the Fed kept missing to the downside, inflation expectations would start to fall, and the US could find themselves in the situation of Japan, where it's very hard for monetary policy to be stimulative and for you to get off the zero lower bound for interest rates. They also changed the Fed's employment objective. Before, they talked about deviations from maximum sustainable employment. Now they talk about shortfalls. So they don't care if inflation, if the unemployment rate, if the level of maximum employment has gotten too high. They're really concerned more about employment being falling short of the maximum level that's actually achievable. So that's another important change from the Fed. So this is the long-term monetary policy framework. And then, so in September, they basically translated this long-term framework into what this actually means for monetary policy. In the Federal Open Market Committee statement in September 2020, they outlined new conditions for liftoff. First, the FOMC would have to assess that the economy had reached a level of maximum sustainable employment. Second, inflation would have had to reach 2%. And the Fed would have to be confident that inflation was on track to moderately exceed 2% for some period of time. The Fed saw a number of benefits of moving to this new framework. First, there'd be less risk of inflation expectations becoming unanchored to the downside, because now the Fed was committed to letting inflation go above 2% for a while. Second, the short-term rate peak would likely be higher, because remember, inflation is now higher, so the Federal Reserve is going to be moving to a tight monetary policy. Well, that actually has a benefit, because if the short-term rate peak is higher, the Fed has more ammunition to cut rates to deal with future economic downturns. It also means that the Fed's not going to tighten prematurely if it turns out that there's more room for the economy to grow and get more people employed. During the expansion that followed the great financial crisis, the Fed thought that full employment was quite a bit lower than what actually turned out to be. This time, they're not going to make that error. They're going to let the labor market, wages, and inflation tell them when we've actually reached maximum sustainable employment. And the Fed think this is also attractive because letting the economy run hot will probably provide greater employment opportunities for those who are less advantaged. So those are the benefits, but there are also some potential costs. First of all, there's going to be more volatility in short-term rates. The Fed's starting later, but because they're starting later, they're going to have to go higher. Policy is going to have to be made tight because the Fed is basically not starting until inflation's actually risen above 2%. And second, recession risks are going to be higher as a consequence. If the Fed has to make policy tight, there's a much greater chance that they're going to overdo it, and we're actually going to have a recession outcome. And of course, that will potentially harm those who are less advantaged, who got hired at the end of the cycle. So let's compare and contrast the new regime to the old regime. The old regime, you began to tighten before you reached full employment. The goal was to arrive at a neutral monetary policy, 2% inflation, and full employment all at the same time. And if you did this well, you could just stay there, hopefully indefinitely. The new regime is quite different. You don't start to tighten until you're at or beyond maximum sustainable employment. You don't start to tighten until inflation exceeds 2%. So monetary policy has to be made sufficiently tight to push the unemployment rate up and inflation back down towards 2%. The Fed's shift in policy is already evident in terms of what's happened to securities dealers and investors' expectations. Between June of 2020 and September of 2020, dealers and investors said, we now expect the Fed won't lift off until the unemployment rate's about half a percentage point lower and inflation's a few tenths higher compared to the old regime. So just the Fed's announcing this shift in regime has changed expectations about the timing of liftoff. So what's my evaluation of all this? Well, I think there were good motivations for these changes in the monetary policy framework. Zero lower bound risks are obviously quite real, since we've been at the zero lower bound for interest rates twice in the last 12 or 13 years. And there is quite a bit of uncertainty about what constitutes full employment. So you don't want to keep people unemployed unnecessarily. You want to make sure that you actually get to that maximum sustainable level of unemployment. Now, as you notice, that the Fed's been pretty fuzzy about how long they'll let inflation rise above 2%. But I think that fuzziness is appropriate because the Fed can't hit any inflation target precisely because there's a lot of other factors that drive inflation around month to month and quarter to quarter. Also, the Fed has to be a bit fuzzy in terms of how much inflation they're willing to tolerate because the link between actual inflation outcomes and inflation expectations is unclear. Remember, the goal of policy here is to keep inflation expectations well anchored at 2%. It's not clear how long inflation has to be above 2% to accomplish that mission. In fact, if the Fed was completely credible, just the announcement of this policy might be sufficient to keep inflation expectations anchored at 2%. You might not even have to overshoot 2% inflation for any significant period of time. The downside, I think, in terms of the Fed's approach at this point is they've been emphasizing the benefits of this policy, more people unemployed, inflation expectations better anchored, but they haven't been discussing the costs. And the markets are happy with this because they know that Fed tightening is a long ways off. But when the tightening finally comes, it's going to be larger and faster because the Federal Reserve will be behind the curve. And the risk of recession will be a lot higher at that point. It's very hard for the Fed to achieve a soft landing when the unemployment rate falls below that consistent with full employment. Claudia Sam was an economist at the Federal Reserve Board, and she did a study that basically shows that when the unemployment rate rises by about 0.5 percentage point or more, you always end up with a full-blown recession. Since World War II, there have been no episodes where the unemployment rate has risen just 0.5%, just 1%, or just 1.5%. So if the Fed allows the unemployment rate to get down to, say, 3.5%, where full employment is actually 4%, the Fed is almost certainly going to generate a recession. So what this just underscores is there is no free lunch. There are benefits of this change in policy, but there are also some costs. So where do we go from here? Well, the monetary policy outlook over the next few years is highly uncertain. We don't have any experience about recoveries from pandemics. And as Jessica made clear, we still have a lot of uncertainty about how this pandemic is going to continue to unfold. But as I see it, monetary policy, there's really sort of 4 stages. The first stage is the stage we're in right now, maximum monetary policy accommodation. Short-term rates at 0, quantitative easing continuing at $120 billion per month. And the Federal Reserve has said we're basically going to keep doing this until we've made substantial progress towards our objectives of maximum sustainable employment and 2% inflation. Stage 2, once they have made that substantial progress, then the Federal Reserve is going to start to taper the rate of asset purchases. This probably is going to happen, early 2022 seems most likely. Chair Powell has said it's too early to even talk about this yet, so it can't happen too quickly. In stage 3, after the tapering of the asset purchases has been completed, the Federal Reserve will lift off. They'll start to actually raise short-term rates. Now, if you look at the Fed's summary of economic projections, they say this isn't going to happen until 2024. But financial markets say this is likely to happen quite a bit earlier than that. Some probability as early as late 2022, but very likely in 2023. So we'll see who turns out to be right. And then stage 4 is when the Federal Reserve finally starts to normalize their balance sheet. They won't do that, though, until they've actually lifted the federal funds rate off the 0 lower bound, because the Fed wants to have room to be able to cut short-term interest rates if the economy gets hit with some negative shock that hurts the economic activity. The target Fed balance sheet, in terms of normalizing the balance sheet, will be about $5 trillion. The bank demand for reserves is probably somewhere north of $1.5 trillion. We know this because we saw lots of volatility in the repo market in September of 2019 when we got down to that $1.5 trillion. But the question here is, will the Fed ever get to their preferred balance sheet of $5 trillion? Because when the Fed ends quantitative easing, the Fed's balance sheet is probably going to be on the order of $8 to $9 trillion. So it's going to take a long time for Treasury securities to run off to ever get back to that normalized balance sheet. So my view, relative to the consensus view and what the Fed thinks, I think the Fed is probably going to start a little earlier in terms of liftoff. Not because the Fed doesn't want to be patient, but I think that the recovery in terms of the economy could be a lot more violent, strong, and substantial. And so each phase, stage 1, 2, 3, and 4, could happen a lot more quickly than what we saw following the great financial crisis. The great financial crisis recovery is a very bad model, I think, for the COVID pandemic, because coming out of that economic downturn, household balance sheets were in terrible shape. There was a huge reversal in fiscal policy from stimulus to restraint. And I think this time, the monetary policy and fiscal policy side is going to provide accommodation for a much longer period of time. But having said all that, we don't have any experience with this type of business cycle. So some humility is warranted in terms of making predictions about how all this is going to turn out. Thank you.
Bill, thank you. And thank all three presenters and discussants. And now we're going to move right into our sort of more open discussion and some Q&A from each other, but also from our listeners coming in. And to our listeners, if you haven't already, please go ahead and submit questions by clicking on the Zoom Q&A button at the bottom of your window itself. And again, a number of questions have already come in. Let's jump right in. And really, the question for all of you, and we have about, 30 minutes or so. Steve Redding, Jess wrote in, going forward, will COVID-19 become just like the flu, where we have an annual vaccination to protect against the latest variants of the disease? And he continues and asks, how large are the chances of a more significant, a larger future mutation that our current vaccines will be ineffective against? And you talked a little bit about the variants, but he wants you to look into that crystal ball given where we are. So number one, what about it? Is it going to be an annual routine event going forward?
So it is possible, this is crystal ball stuff, right? So it is possible that, and this is around the question of secondary infections or infection after vaccination. If those are incredibly mild and remain incredibly mild, then we'll be in a world where it just becomes another common cold. Even updates of the vaccines, it might be that most people are very protected against most symptoms. We don't know that that's true. That would be a future in which it became another what we call endemic common cold virus, and it would just be, it would pass without comment in some sense. If not, then it is possible that based on what we know of other coronaviruses, we would be in a situation where we would need to update the vaccine just as we update the influenza vaccine, because there would be a little bit of drift in the mutations. And the new technologies around mRNA vaccines are very sort of hopeful in terms of how fast we could do this. Of course, there's everything to do with logistics and getting those vaccines out there that remain challenging. And I think if we're thinking in that space, we are also thinking of a world in which probably the infection is circulating, at least to some degree, partly perhaps because we can't vaccinate children. There is, of course, also the world where their secondary infections are very severe, or infection after vaccination is very severe. And then I think we're in a world where we still have many measures in place alongside vaccination and regular updating of vaccination. So the crystal ball has many paths and a lot of uncertainty around many of them. The question about could we get a large mutation that escaped all of immunity? Again, a very hard question. I think that there's only it's been an extraordinary experience as an evolutionary biologist, because one of the things we've seen is the same mutations pop up in completely different parts of the world that allow the mutation to do things like escape immunity or be more sticky to cells. So this is like wings evolving in birds and bats. It's a remarkable example of convergent evolution, but they're all probably constrained. There's probably not infinite space they can move in. So as transmission is moving up a little bit, as perhaps immune escape is moving up a bit, it's likely that it is at least possible that it'll end up in a place where it can't move any further, it can't escape any further, and potentially, it won't be able to become completely invisible to our immune system as a result of this. This is all speculation. We don't actually know.
Jessica, continue just a little bit on herd immunity. 5 months ago when we were last together, and also actually from the very outset, we talked about herd immunity. You don't hear quite as much about it, but just give us an update. What should we be thinking now, mid-April, about herd immunity, vis-a-vis both vaccination, but also the natural spread of the infection?
So herd immunity refers to reaching the point where enough people are immune so that one infected person results in less than one new infection. So the number of cases will shrink. It became clear last year, very early last year, in fact, that the mortality toll that would be incurred by reaching herd immunity by natural infection would be intolerably high. And it's important to remember that the point itself is shifting since it depends on human behavior and other elements. And even after that point is reached, you're going to have many more cases on the way down, right? You're just at the peak of the outbreak. And what is obvious, and I think you hinted at the Senator, is that to reduce the numbers of deaths and cases, we need to increase the number of individuals who've been vaccinated, and this will both protect them, but also is likely to indirectly protect other people and thus make things better generally. Will this get us to a place where one infected individual results in less than one new infection? Perhaps in some places, but almost certainly not everywhere for a long time, because of the factors I mentioned to do with both hesitancy, but also the fact we can't vaccinate children. So the herd immunity threshold is likely to be quite high, which means we're likely to be quite a long way away from it, which means that it's gonna take a while it's not clear that we should be thinking in terms of vaccination and upping immunity rather than that sort of target, perhaps.
Alan, the causing inflation, and let's comment, we have several questions coming on inflation, and all of you have touched a little bit on it. Any comments, the whole criticism that the fiscal stimulus is too much in inflation as we look ahead? Again, a lot of this is crystal ball, we all know, but extend that conversation a bit for us.
It is crystal ball, and let me just say mention a few things that cloud the crystal ball. Prefacing it by saying it's not an impossible scenario. So this is not, when people worry about too much stimulus causing inflation, it's not like they're saying there's human life on Mars or something like that. It's not like that. My guess is it's not going to be a problem, but it's not an inconceivable. It's not inconceivable you reach the other conclusion. What are some of the big clouds in this? First, I would put the death, I'm going to call it the death, unless it rises from the dead, of the Phillips curve. So we used to have a statistical tool called the Phillips curve that predicted, with errors of course, the behavior of the movements of the inflation rate as the unemployment rate moved. And in particular, as the unemployment rate moved down, inflation is likely to increment up. Not shoot up to the stratosphere, but increment up. This has not happened for 20 years now. And Bill didn't mention this, but he knows that's one of the reasons behind the Fed's giving up on so-called preemptive strategy against inflation. We used to think we could predict inflation by looking at the unemployment rate. Now, a lot of us don't think that anymore. And as a codicil to that, the last two episodes of super low inflation that we've lived through, in super low unemployment, that we lived through at the end of the 90s and then just before the pandemic hit, hadn't led to any inflation whatsoever. I don't mean just modest increase in inflation, zero increase in inflation. So to me, that's a very big cloud, other than what's the pandemic going to do, which I guess overwhelms everything, is the question of how much slack we have in the economy. If you look, I pointed out that GDP is kind of giving a different signal than employment. That's only one little bit of it. The labor force participation rate, we think is going to snap back as the pandemic dissipates and as more businesses open up and daycare opens up and things like that. But it's moved quite a bit down and we're not quite sure about that. And maybe there's a big upside to that. The other thing, and I'll just stop here, but you could go on with clouds, is the potential, how much scarring there's been in the business sector. We know a lot of businesses have gone upside down and disappeared from the face of the earth. That's a constriction of supply as the economy opens up again. And what we don't know is how fast that'll come back. I'm pretty optimistic on that. I believe in capitalism. And you let capitalism run, it's going to run. But questions could be raised about that.
All right, Bill, I want you to extend that a little bit further on the inflation, but let me set it up by framing it to what we, in our opening comments, all of us referred to, and that is that the burden of COVID has disproportionately impacted certain populations and families. Do you think factors, or that actually does factor into the Fed's thinking of letting the economy just roar and run hot and pushing the envelope on what constitutes full employment?
I don't think it's the primary motivation. I think the primary motivation is trying to keep inflation expectations well anchored at 2%. And as Alan pointed out, the uncertainty about where is full employment and what's the consequences of going beyond full employment for inflation. But the fact that the Fed's actions disproportionately helped higher income, wealthy individuals probably makes the Fed very conscious of the benefit of allowing the economy to run hot, so that the Fed can be associated not just with helping rich people, but also helping poorer people. So I think it pushes in the same direction. And I think it helps the Fed in terms of their rhetoric, in terms of how they explain themselves, in terms of how they present their goals. It makes the Fed look a little bit more even-handed in terms of how monetary policy is, it's here not just for wealthy people, but it's here for all citizens. So I think it's consistent with allowing them to be a little bit more politically broad in terms of their constituency that they're addressing.
Jessica, let me come back to you and get a number of questions on the sort of epidemiology and some of the clinical issues. Ileana writes in, and I'd love to hear Jess's take and everyone else's too, but Jess, let me pitch it to you on whether you think that the pharma companies should share their vaccine recipes, what they know about the vaccines, with other companies in order to speed production. And that's in response, I think, in part to your equity issues and the world figures that you gave.
So this is not my domain, and I'd love to hear what Bill and Alan think. But I think that would be in terms of global reach of the vaccines, which is so important for all of us, and so important in terms of keeping numbers down, which means keeps mutations down, which means keeps our future secure. I think it seems to me that it must in some ways help. But
let me open up to Alan or Bill. It's really been remarkable to me, having worked my whole professional life in medicine and healthcare and interacted with pharmaceutical companies and drugs and written hundreds of thousands of prescriptions. The amount of cooperation there has been over the last year among our pharmaceutical industry. And I say that because it's one of these new findings of people helping each other out in terms of manufacturing and sharing of information. And clearly they have their own proprietary interests going forward. But any comments on Ileana's question, either?
Alan? First, let me start where you just were. Nobody's worrying about, and they shouldn't be worrying about, enforcing antitrust statutes against Merck and Pfizer now, for very good reasons. I heard now to the question, I heard the other day on a left-wing political channel, so it wasn't Fox, some people grousing about the high profits that Pfizer and Moderna were making. And I said to myself and to Madeline, who was watching with me, this is nutty. There has never been a better example of the invisible hand. Driven by the profit motive, among other things, these companies have done more good for humankind than most other companies have done in their history. So point one is nobody should be worried that these companies are making a big profit. Point two, however, is that once a company, this is true of drug companies and true of other types of businesses as well, once a company has recovered its cost of the research and the early development and the manufacturing and the trials and all that, which are immense in these cases, the marginal cost of another dose is presumably very small. I don't know what it is, but very small. And that to me makes an enormously powerful case once you put it together with the epidemiology for shipping massive amounts of this of these vaccines, it's not just one, to the third world. and not expect them to pay like Americans and Europeans pay. I think the case for that is overwhelming. Bill, I think you're muted.
Anything to add to that?
I mean, I agree with Alan. I mean, I think that the profit motive actually worked here. Companies took risk, and they were rewarded for the risks they took with vaccines that seem to be quite have a high degree of efficacy. But at the same time, you don't want the cost of these vaccines at this point to be so high that people in the third world can't afford them. So getting that you can get that cost down, in a number of ways. You can have the richer countries chip in and pay some of the cost, or you can get the companies themselves to realize that there is a public good at stake here in terms of getting vaccines disseminated broadly, and so maybe not charge quite so much for people that need those vaccines in those less well-off countries.
May I add one thing? Sorry.
Yes.
So COVAX was set up in part in the wake of the Ebola outbreak, where there was a vaccine in phase 2 trials, which was never taken to development because it was perceived to be unprofitable. And then the Ebola outbreak happened. So I think there is also, certainly the profit argument should be there, but vaccines are a little different, right? There is a way in which we should be prepared for nebulous threats. And COVAX was an important part, I believe, and this is again at the margins of my expertise, of the development of a number of these vaccines. So I think some innovation and thoughtfulness about those investments and that sort of, very public health oriented investment is a really important part of our future, because there will be another pandemic.
Yeah, the government can play a big role there, right? I mean, the government can play a big role in basically creating the market for the vaccines before you actually know the vaccine actually has a high degree of effectiveness. And that's what happened in the case of the United States, so that you allow that motivated companies to take the chance, knowing that they were going to have a lot of sales, regardless of whether the vaccine worked or did not work. So there's a big role for government here.
Yeah, I think that this relationship between government and pharma, the big pharmaceutical companies, in terms of preparation of the pandemic. In 2005, I wrote a lot about this. And it was when I was in the Senate, and I thought I had a lot of influence then, but didn't have very much. But ultimately, because of how we had to prepare for the pandemic, and a lot of it was back then, this is where the modern miracle that I open with today, it would take 10 years to build a vaccine. And the fact that we did it in 8 months, not we, but the world working together, pharma and individuals, was just amazing. But it means we need to be prepared for the next one. And just not to give an advertisement, but Steve Ubel, who runs pharma, he and I had an hour discussion. It'll be on next week's podcast for people who are interested coming to it, second opinion, because of this very issue. Let me shift a little bit, and Bill, go back to you because you touched upon it, the great financial crisis, and you mentioned some of the differences there, but it is pretty amazing this time around, at least to me, that there's been this strong, this bold, this widespread support for the Fed's interventions this time around. I mean, just uniformly, left, right, Republican, red, blue, Democrat, just everybody, has been there. Why is the disparity again? And I'm thinking in terms of how should we look at this in the future coming through, but explain the disparity just a bit more.
Totally different enemy. Everybody hates the COVID-19 and knows that that's the common enemy. Last time, the problem was large financial firms, which the Federal Reserve essentially had to rescue to prevent the economy from collapsing. And that was necessary. But the Fed did a very poor job, I think, explaining why it was necessary. So a lot of people in the public basically saw the Fed as just rescuing fat cat investment bankers, not doing things to actually support the average American. Remember during the last downturn, all the problems that people had in terms of mortgage foreclosures. There was a lot less, attention paid to mortgage modifications than there was to keeping large, complex financial firms going. And that created a huge problem for the Fed in terms of public relations.
I agree with that. Let me just add, this is amplifying what Bill said. In the great financial crisis, there were a lot of newspaper headlines about the Fed or the Treasury or both, quote, bailing out this bank or that bank. Now, often that word was used inappropriately, but it was used all the time. And so if you were just a citizen of the United States or anywhere, you were just hearing, had this vision that your money your taxpayer money was being shoveled into these evil banks. And we basically had none of that on this round.
Let me, again, some great questions are coming. I'm trying to group some of them. And I guess I'll come back and give this to you, Bill. The whole idea of the whole concept of risk. How concerned should we be that all these federal or the Fed interventions will encourage more risk taking in the future? And another question, won't investors expect to be bailed out next time? And won't that expectation encourage even greater risk taking? Absolutely.
I mean, if you know that the Fed's always going to ride to the rescue, you know that the downside consequences of your actions are going to be less severe as a consequence. That's why people are already having a discussion about what are we going to do to fix the U.S. Treasury market. One of the most surprising developments of the last year was when the U.S. Treasury market became dysfunctional March and April of last year, and the Federal Reserve had to ride to the rescue. To the extent that the Fed comes in and buys hundreds of billions of dollars of treasuries, that's protecting all the people that had overly leveraged positions in the Treasury market. So this moral hazard problem is a real one. That said, you can't let the whole city block burn down just to teach people a lesson. So I think the appropriate response is to basically say, where are there the vulnerabilities in the system? What can we do to fix those vulnerabilities so the Federal Reserve doesn't have to ride to the rescue when we're actually in a period of crisis?
Let's see, some general questions, and it's kind of nice to look at these because when we do our next symposium, you look back and see how correct we were. And some general questions, and Michael Sirocco, has the pandemic permanently changed the way we shop for goods and work in offices? Best guess as to how brick and mortar retail stores and office buildings evolve. I guess just some reflections. You know, everybody listening to us is thinking, when am I going back to the office? Am I going back to the office? What's this done in my personal life? And we're all struggling with it in our own ways. But how would you answer, Michael? Let's just go around the horn. Alan, do you want to jump in? And then
I think it's a great question. It's one of the $64 trillion questions. There's no doubt, that there was a trend away from brick and mortar stores towards online. There is no doubt that COVID and the responses thereto have accelerated that trend. And the question is how much of a, so the trend is going to be there. It was there before, it's going to continue. The question is how much of this huge bump towards online will dissipate once people can go to stores. Nobody knows the answer to that. I'm glad I'm not in the retail real estate business. I'm an optimist on that. I think people will, not to the pre-COVID level, but will flock back to stores for a number of reasons, including the socialization. I mean, we used to meet our neighbors in the grocery store. And lots of people meet their neighbors in the grocery store. And many other reasons like that. So I think there's kind of a pent-up demand for shopping, but not back to what it used to be. The place I think, and David Otter has been eloquent on this a number of times, where you're going to see a permanent and gigantic effect is travel, especially international travel, but in general, long distance travel for business meetings. Companies driven by the bottom line have noticed that, you know, it used to take $600,000 to bring our whole board to Singapore for 3 days or something like now, and now we do it for $60. It's not quite as good, but I'd rather have the 600,000, what did I say? $6 million, whatever. I don't know what the cost. I'd rather have that money back on the bottom line. So I think that's a place that we're gonna have a permanent and large effect. And I should just add as a codicil to that, the first thought when I heard this thought is, you know, who cares what these big tycoons are doing, whether they're getting to go to Hawaii or not? But there are a lot of low-income people, modest and low-income people that earn their living through that. Hotel chambermaids, people that work in restaurants, people that work in the airlines, not just the pilots, but much less well-paid jobs, and so on. And I think a lot of those jobs are never coming back.
Yeah, I think the other consequence is going to be in terms of where do people do their work. I mean, I think people will go back to work more, but it's not clear to me that they're going to go back 5 days a week. They may go back 3 days a week. And it may not be as many people have their own office. They may share offices. So I think there's a huge question mark about office buildings and how much office building space is going to be needed as we go forward.
I think it's really interesting thinking about the shifting cultural norms. I don't think anyone's going to go to work with a cold if they can possibly avoid it anymore, which I think is interesting. And I wonder if there's going to be changes around sick leave and things like that. I would like to believe that there are, because clearly the consequences are so embedded in our minds now.
And the question clearly was going back to work, but 20% of our economy, that is the healthcare, the 18% we spend in health and healthcare, has been radically changed and transformed forever. The fact that you can get a doctor within 8 minutes on your telephone 24 hours a day or video camera is very different than 14 months ago, where to get a doctor, you could never get them on your telephone. You drive an hour, you sit in a waiting room for 45 minutes, you fill out a bunch of forms before you even see a nurse or a licensed practice a caregiver before you'd see the doctor. So it's just been radically changed. Our move, as I mentioned, towards value-based care, where you really are looking at quality and outcomes. You have a consumer that's going to demand more affordable, convenient care. So a lot of changes, and the list goes on and on and on, but I can't help but throw that in because it is 20% of our economy as we go forward. Charmin asked, with such concerns about money supply and continued fiscal stimulus, how should we think about the value of the dollar and the hype around Bitcoin?
Well, at the end of the day, the fiscal policy has to be on a sustainable track ultimately. And the question is, when will that occur? Right now, I think that the dollar is going to be doing fine because the US is going to have a strong recovery. We're a little bit ahead of other countries. And so I think that money will be easily attracted to the US, especially with our interest rates higher than interest rates in Europe and Japan. But longer term, at some point, we're going to have to get our fiscal house in order. And if we don't do that, then foreign investors are going to start to balk and continue to supply dollars to us. And so longer term, I think there really is a question of whether foreign investors will continue to retain their confidence in the fiscal sustainability of the U.S. But that's probably many years down the road.
I agree.
Anything else, Alan? And any comment on Bitcoin?
No, I agree with that, except just to add, it was implicit in what Bill said, that for the dollar's role to fade, some other currency has to step up and take over the role. I'm quite confident it's not going to be the RMB until long after I've met my maker. And probably after a lot of people younger than I have met their makers. The only real contestant in the next 25 years is the euro. And the Eurozone's got its own problems. So I don't think this fall from grace of the dollar, if you want to call it that, is on the near term or even the medium term horizon.
It only happens if we really mess up.
Yeah. Jessica, William Cross writes, one of the big winners here was messenger RNA. We touched upon this a little bit with the great, miraculous evolution and progress in science. But he asked, what lessons for public policy are there from the ways in which this technology has been so successful, both in vaccine intervention and vaccine production? And just as background, messenger RNA, this is the first time it's been used, and we haven't talked about vaccine hesitancy, so we could come into that as well, Jessica, maybe. But the fact that it is brand new technology that's never been used to make a vaccine. A lot of people say, I got to wait a few months to make sure this is okay. On the flip side of that, it is just tip of the iceberg for other technologies coming along. And a lot of these vaccines, the J&J vaccine was made as an offshoot of a similar way the Ebola vaccine was made. Again, very different than the other two. So they're not all being made exactly the same. There's a lot of science, broad science, and the messenger RNA was the quickest, the cleanest, the least likely to cause side effects. And indeed, that's what it seems to be. Jessica, what what else in terms of technology, messenger RNA, vaccine development, and how it's changed the way, you know, you do your modeling or herd immunity or that broader sense of safety for the American people and people globally?
I think it's, you know, it wasn't on my radar at all before this pandemic. And I think the technology had been bubbling in the background for a while. There had been some development around a few vaccines. So it might have been just that we were at that sweet spot, or perhaps there was a, you know, a need for an investment that needed to happen. I'm not entirely sure. What is true that it is extraordinary how flexible it is and how simple the logic is in a way. And I think this came through. My understanding is, you know, that the roots were very much in academic research, which makes me happy because that is where I sit. So I think it does, you know, it does create an incentive for that, opening that blue skies thinking and opening that way to that sort of research. In thinking towards future pandemics, it also, this almost this kind of mix and match ability to build a vaccine means that we're in such a much more interesting place in terms of trying to anticipate future threats. Like we might be able to make vaccines to things we haven't even seen yet, but that we suspect might be coming along, as opposed to the other technology you referred to, which is the vectored viral vaccines, where you have to kind of take an existing virus that's attenuated, that has very little effects, and then kind of put a little bit of the spike protein in there. So there's a lot of sort of fiddle involved and a lot of, you know, moving with a living organism. So I think in terms of, you know, it really, the limits of the technology in terms of, you know, everything from thinking about how we manipulate our immune system in how it thinks about cancers through to, you know, the prospects are sort of dizzying. But on the other hand, the immune system is one of the most complicated things to maneuver around in the world. So I don't want to sort of overstate that promise, but it is very exciting. And it is very exciting for both infectious diseases and I think potentially for chronic diseases.
Let's see here, great questions coming in. We got about 7 or 8 more minutes, and this is a part of statement and part of question, and so I'll let people react. Andy Cowherd writes in, some have argued that it is better for Pfizer, Moderna, and others to supply the world rather than free up patents and let lesser qualified or inefficient production draw from the relatively tight supply of raw materials. Conceivably, worldwide supply could be reduced if more inefficient players get in and muck things up. All right, so a response to Andy.
Well, there's a public good of having the best vaccine win and have that vaccine be the one that everybody uses, I suppose, except for the variants, right? You know, if you are worried about the variants and don't know which vaccine is going to be the most effective about the variants, then maybe you want to have more than one vaccine in place.
There are also, I think, about 7.5 billion people on Earth, and even a company as big as Pfizer is not going to produce that much vaccine. Moderna, it's worth reminding ourselves, was a small company until this.
Yeah.
I think it was their first product.
First big product.
I think their first big product, yeah.
Or maybe their first product. I mean, it's fantastic. But asking those two companies to provide enough for the entire world, I think, is probably asking more than they can do.
I completely agree with Alan. I think, you know, the COVAX has the funding to provide 20% coverage for the countries that have signed on, but they can't get the doses because, you know, there's already, they've been allocated to other countries. You know, every Canadian has 5 doses allocated to them or something. So there just isn't enough to go around.
I think as we prepare for the next pandemic, and there will be another pandemic, in spite of all the great progress we've made, people tend to not pay attention after this pandemic's over and past pandemics. We've just seen that, and how we best prepare for it does show the importance of having global relations and not just thinking about ourselves. And this was all modeled out a year ago in terms of the ultimate demand around the world. And we've prepared for it, I guess, best we can, but to have global relationships and global planning is just absolutely critical. And when America's walked away from that, we do a disservice, coming back really to your last slide, Jess, in terms of the equity issues and the moral imperative, I believe, coming forward. We talked, Alan, we talked, and Bill and Jeff, we talked last time about the stimulus packages. Alan, you gave us a great review. I was taking notes as you did it a few minutes ago, in terms of how much we've spent, but how much how much is stimulus and how much is sort of real, the sort of creation long term of whether it's jobs or whatever the measure is. And AJ Schropp writes, what portion of the $1.9 trillion American Rescue Plan and the proposed $3 trillion Build Back Better plan will help the economy get into a higher multi-year growth trajectory? And what portion is more likely a one-time benefit repair of lost income?
I think you want to think of most things in the CARES Act, almost everything, and most things in the 1.9 billion, which is just coming along, as relief and repair, analogous to what we do after a hurricane or earthquake. Money then poured, this would be, in those cases, it's a local area. Money pours in to rebuild physical assets, health assets, and a whole variety of others, and to provide some emergency income support. So most of those two were of that nature, and therefore, and they're one shot, by the way. The Build Back Better is a large melange of things, some of which are classic infrastructure. So if you build bridges and tunnels and repair highways, that's going to be giving economic benefits for a very long time. And some of which are building human assets, which will probably also last for a very long time. A lot of people on this call probably know that this is just slightly off topic, but only slightly, is one of the best things you can do from an investment perspective is early education for preschool children, which lasts their whole life. It's cheap and it lasts their whole life. So there are things analogous to that in the Build Back Better. And that's where you look for the things that are permanent, or nothing's permanent, a very long lasting benefit to the economy.
Yeah, I think we've stressed how government, and I love it because having been in the Senate, the Senate gets beat up all the time, and appropriately so much of the time. But I think that the Senate and the House it did respond, as you, Alan, outlined, in a quick, yes, sloppy at times, but a responsive way. I think now we are in an environment, and I'd just like to encourage our listeners to participate in the process in whatever way possible, that things are under a little bit more control. You can talk to your legislators, you can express yourself, and people say, oh, they're not going to listen, or I see the partisanship and it's not going to change. But it can change, but people need to participate. And in this environment, legislators will be listening and their staff will be listening, and to have a reasoned, rational, do things less sloppily this time around, it's really within the reach of all of us going forward. I hate this part because I've got to wrap things up. We got just 2 minutes. Jessica, Jess, or Bill, or Alan, any 30-second comments or closes before I wrap things up?
I would just say that things have turned out better than I ever expected, just looking back, a few months ago.
Yeah.
I mean, they were first worse, and now they're better because you can see the light at the end of the road. And I'm just speaking for myself psychologically, just getting vaccinated gives you a new outlook on life.
It feels good. Right.
It feels good. So yeah. I think we're on a good path, and I think the next year is going to be a heck of a lot better than the year that we just had. Yeah,
Jess, you want to jump in?
I really hope so. I really hope so. There have been unexpected bumps along the road, but absolutely agree with Bill. It's been extraordinary, the change that having the vaccine has made, and hopefully those gains will be maintained.
Yeah, I love, Alan, those exclamation points in your point number one. The vaccines is so fundamental to it, and you put not 1, 2, 3 exclamation points. Alan?
Yeah, I think we wouldn't be having I think, as I said, we're looking at a boom year in 2021, and without the vaccines, we would not be having anything. I hate to finish on a down note. Maybe I shouldn't, but something you said earlier reminded me that I think one of the lasting perils of this, aside from whatever remains of the virus is the damage to globalization. That is very likely a long-lasting negative spillover from this episode.
Well, listen, thank you all. I do want to share just, I am optimistic, much more optimistic about our future now than I was 5 months ago in lots of ways. We're well on our way to vaccinating, as Jessica said, the majority of Americans against COVID. And if you think back just since vaccination began on December 14th, not that long ago, we've had 192 million doses have been administered, and that's vaccinated over 75 million people, about 23% of the population. That to me is just truly remarkable. When President Biden had that initial goal of $100 million vaccines into the arms in his first 100 days, and he reached that on day 58, and that wasn't that long ago. And the president has doubled that goal to 200 million vaccines by the end of April, just 2 weeks from now. And since mid-January, the number of U.S. hospitalizations has steadily and swiftly gone down. The number of new cases has decreased, and that's been, remarkable. I think it's like 40% over just the past 2 weeks, down 70% since its high point on the 8th. And again, all that's real progress. And all of those, the issues we talked about in our first three in this series, the sort of challenges we had of 2020, seemingly insurmountable at the time, have, as we talked about today, spurred innovation and creativity and dynamic changes. We've had this explosion in virtual care I mentioned in my own field, unheard of, and we talked about it, the global scientific collaboration, vaccines in record time, and we usher in this whole new era where we had spent the last few minutes of vaccine and drug science. So to all of you, to our three panelists today, thank you so much. Thank everybody else for spending this time with us. And again, you can receive this in the podcast at the center itself or on a secondopinionpodcast.com. And we encourage you to share those podcasts with other people as a resource going forward. With that, thank you very much. And we look forward to talking to you in the not too distant future. Thank you.
Thank you.
Thank you.